There you go. Here we go.
All right. All right. Thanks everybody for being here today. So thank you for your time and for being here on time. My name is Yvette Cardenas and I'm a licensed clinical social worker and one of the supervisors here at Luminarias today. Joining me in this presentation are our other very knowledgeable supervisors, and I'll let them introduce themselves. So we'll start with Dr. Cardenas.
Yes, I'm Dr. Cardenas, CEO of Luminarias. One of the supervisors, I primarily supervise what we call LCS staff, who are shifted from interns and trainees to paid interns with the agency. And so they were in the other newer person spots a year or two ago. Okay, so next, Nahil, how's that?
Hi, everyone. I'm Nahil. I am also a supervisor at Luminarias. I've been working with Dr. C for some time at the private practice piece and happy to be involved supervising trainees. And then
Lily.
Thank you. Yes, Liliana Hernandez, one of the other supervisors here at Luminarias, and I also work with Dr. Cardenas in the private CPS section of it, and glad to be here and be of service.
So we'll do it. So you're gonna get input from all of us in regards to our topic today. So we've scheduled the next 2 hours to discuss strategies for engaging hard to reach children and adolescents. So some common questions and concerns that come up with kids that basically have a hard time engaging during sessions. So we usually get the question of, the kiddo doesn't want to talk, I don't know what to do. And the clinicians often feel like they are slowly pulling information like they're pulling teeth. So we're here to address some of that. Okay. Okay. So, before we begin, we have a question for you all, and we hear a lot of this in supervision, but we want to get your thoughts. What are some thoughts or feelings that may come up for you as a clinician before the initial session with the clients, with the minors' parents for their caregivers? Any thoughts, anything that you've heard of? And you can feel free to speak up or answer in the chat. Anything that comes up for you. Or that you've heard.
Yeah, and if we want to either share in the chat or if somebody would just like to unmute themselves and let us know what comes up, what thoughts or feelings.
And we're talking about those anticipated feelings, right? Before you make that phone call, when you get that referral, you're like, oh my gosh, it's, a 12-year-old. I have to talk to the parents now. What am I going to do? What's going to happen?
I always make sure to talk to the kid first, because sometimes there's a lot of things that they don't want their parents to know, or sometimes when I've spoken to the parents first, there's a lot of minimizing. And so then, I'll go into the session, and even though I want to ask all the right questions, like I'll just inevitably miss something. So I always try to talk to the child first, especially if they're, teens or preteens. So that's helpful for me.
Thank you, Claudia.
Thank you. Yeah, thank you. What other thoughts? And even think back to the first time you were you got your first client assigned. What came up for you when you were like, oh my gosh, it's getting real?
Well, I guess I'll go. I remember, I think one of my first clients was an adolescent, had to speak to parents, and I was scared of how do I address them? What do I say? What are the right questions I ask the parent about what's going on with the child? So a lot of nervous, a lot of fear.
Nervousness and fear for sure.
For sure. I remember when I had to talk to my first adult parent, especially, and then I was really young coming in. Well, I consider myself really young coming into the field, right? So you come in and you know, you have to practice your assertiveness, and now you're coming in from that point of you're used to being almost told what to do, and now you have this authority, or you know, this role that you need to fill, and talking to another adult like you're on the same level now. I think that just creates a lot of anxiety, a lot of worry. What are they going to think? Are they going to think I'm a kid trying to talk to them? You know, those types of feelings come up too, and that insecurity.
Yeah.
Just looking at the chat, Elena is saying, I recall feeling nervous about parents asking me why I am qualified to treat their children.
Right.
I was going to kind of say that too. Like when you talk to the parent, they're like, you're the professional. You tell me what I need to do. And you're like, no, wait, hold on. So it's kind of like, here, you know, here's my child, fix them. Or you tell me what I need to do. Yeah, that's challenging.
I'll go. Yeah, I remember way back when, before we used computers at all for any of this stuff. And I remember dealing with parents, and here I was in my early 20s, right? And then in my mid 20s, and they're like, especially when I did something like where I'm gonna teach you about parenting, right? When they were like, this is what we're doing. All right, Dr. You know, Jose or Dr. Cardenas, you know, they're here because of this, and we have an issue with the parents, like a DCFS issue, right? And they're, you know, how they're reprimanding or correcting them, disciplining their kids. And here I was, this kid, and it's like, and of course the question is like, do you have kids? You know, I'm like, I didn't. Okay, this was before I was married, before I had one, much less three. And even then, it's like, what do I do? These are teenagers. My oldest one is 5. You know, it's like, so being able to know that, yeah, they're going to ask you some questions that they're testing. What gives you that authority, right? Besides your education, besides your, you know, book knowledge, which is a really valid question. It's like, because one thing is book and one thing is, but this is my kid, you know, and this is our history, and this is, you know, and are we even in your book, right? So being able to anticipate that they may ask you some questions that, you know, it's not really about answering that question, but respecting where the question is coming from. Okay, it's like, I'm hearing your question. I'm not going to pretend like it's not valid. However, well, it's not just me, and this is, I think, really for those of you who are in that position, right? That you're, well, this is one of the first time I've dealt with this issue, right? Or this type of referral, and being able to say, well, in our agency, that's where Yvette, Nahil, Lily, and me are in your back pocket, right? We have all these years of license, of experience, etc. And well, this is what we do, and this is what we are. Then that's when you can talk about the we and get away from the I, you know, because you're representing the agency. And so being able to say, well, yeah, and it doesn't mean that you can't answer the question, but be really careful. Are you now giving them control, right? Or they're going to want to pigeonhole you in basically to their belief that you can't give me any guidance or authoritative advice, right? Or guidance, you know, in any way. So being able to say, well, we can, you know, so, and let them know. And that's where, again, it's important that not just ethically, but to help them get a satisfaction of, oh, this person is in training and they are being supervised. And you can let them know, I am being supervised by all these different people, and they're there to guide me and guide us. Okay, so I remember that really helped me to see. It's like, wait a minute, I don't know what the heck I'm doing. I don't have kids, and the way that my parents parented is probably not the way that. Well, that's not how this, you know, parenting book is saying to do it either. I'm not going to get into how my dad parented because he was a disciplinarian, right? It's like, that's child abuse technically. Right? So yes, being able to anticipate they're going to ask you some questions, right? Especially when you look like their kid, you know, which is, think of that too as a benefit. Us licensed people, it's like, wouldn't it be great if they thought that I was 10 years younger than I am? We have vanity too, right? Right? Versus a lot of the young people, they thought I was only, so much years younger. It's like, take it as a compliment, okay? That they think you're still in high school, so go ahead.
Thank you. I think Brian had his hand up. Am I right?
Yeah, that's correct. I mean, he pretty much nailed it. I think the way that I handled that specific one is I kind of throw back in the corner with something like, so I'm getting the sense that you're worried I might not be able to help you in the way that you're thinking. Is there something specific? Or just being like, look, I can promise you that if we hit this together as a team and we're really on the same page, we're going to see improvements. So, I mean, adding that onto the end of what Dr. Cardenas is saying.
Right. Thank you, Brian. All right.
Yes.
Yes.
Before we move on, Gabriella put something in the chat. I just wanted to say, I had a mom say to me just yesterday, I know with your help, my son will get better. It made me feel lots of pressure.
Yes, sometimes we feel that too, right? Sometimes people look at us and like, you have a magic wand and you're going to fix everything with a child. And unfortunately, that's incorrect. It takes a lot of work to do that from both the family and the therapist and the client, the child. Yeah, it's nerve-wracking.
It is. I just want to add to that, we often have, I'm sure that we've all gotten that type of like statement at one point or another. I learned to navigate that by just going back and asking and letting the parent know, like, nobody knows your child better than you do. So together, I'm sure we can, make a difference. And it just puts the onus back on the parent as well. Like, they're going to be a part of this and expect to be a part of this. So that's another way to respond to that.
Yeah. I would add that taking that and saying, okay, giving them the benefit of the doubt, because we have some abusive parents who are real good manipulators, right? And it's like, and they're going to want to play us. And believe me, I've been played plenty of times, like, dang, I didn't see that coming. I really believe those caretakers, right? And so being able to say, but I would say, take it as like, that's great. They have an optimistic, way of coming into this, which is a lot better than this cynical, esto no saben nada, they're going to want to make my kid, white or whatever, right? So there's a lot of, I'd say, just take a breath and say, this is good. This is something that helps me have a better, less of defensiveness. Okay. So if I hear that, I'm like, great. Yet, I've had enough experience now of there's some really good BSers out there. Okay. Right. Especially the very abusive parents who are really good at presenting to therapists, to DCFS, to police, to courts, a total opposite situation, right? They're gaslighters, right? So being able to take it in a positive way, because we want not only our clients, but which is the extension of that, their other persons, to be able to believe in us, right? Just like we want our clients to believe in us instead of believing in some other people that like told them how terrible and right? They are. So yeah, but just put a positive, optimistic spin on it as much as possible. Back to you, Ed.
Dr. C. Okay. Oh, did it switch? No. Here we go. So usually, when a minor is referred for therapy, our first point of contact is the caregiver, right? Depending on how old they are, if the child reached out for therapy on their own, or if the parents called us, or if they were referred from the school, all those things we take into consideration. Some of the following things to keep in mind as you engage the caregivers are the following, right? Number one is, are you speaking their primary language? There is so much value in being able to communicate concisely with the parent and efficiently. So if you don't, use an experienced interpreter you trust. You're aware, just so you're aware, there is a difference. An interpreter translates orally and a translator interprets text. So you want to just make sure that you're using, the correct person to help you out. Also, in the Latino culture in general, we are both people oriented and collectivist, meaning that Latinos generally value personal relationship. So personalismo basically means having that formal friendliness. So I'll give you an example. Also, at the same time, showing respect and courtesy. So in Spanish, known as respeto y amabilidad. So an example of that, and I don't know if you've experienced it, but I've seen it several times where a client comes into the front desk when you have, large offices, or back when we were in person, they come in to check in at the front desk, and the front desk staff will be like, yes, hi, what's your name? Okay, who are you here to see? Okay, done. There is no hi, how are you? Nice to see you again. Who are you here to see? There's great value in having that. So you take that into session with you, and you show that same respect, that same appreciation for the relationship that you're building. You shake hands if it's appropriate in the culture, right? ¿Cómo está? How are you? How are you doing today? Basic things like that will show you, okay, I have a respect for you. I care about you as a person. I want to build a relationship with you. Instead of, what I've also seen is you get into the office and right away the therapist or, the clinician, the doctor, even I've seen it, where they get into business. Okay, thank you for being here today. I need to ask you a set of questions. And they go down their list and they do their assessment. It turns off the client, right? We also have to consider the person's, their culture, what their practices are and all these things. So we want to be able to show that that courtesy and take into consideration those cultural norms. So that's very helpful. Another example I'll give you is a colleague of mine had a Middle Eastern family, and she's never worked with a Middle Eastern family before. And I can't remember specifically, all the details, but essentially the family came in with a child and she greeted the child right away. Hi, how are you? Nice to see you today. The parents became very upset because it was very disrespectful, especially for the dad, because in their culture, you greet the dad or the adults first and the kids last. She, however, there is ways to rectify this. She humbly apologized for her mistake after learning what had happened, what she did to upset them. She apologized and, learned about their customs and their culture. So we don't always know everything, but keep that in mind in the back of your head as you're working with different families. And you ask them, and I think that was thrown out today, how are you there to support them? How are you there to support their child or their family? They might be scared. They may not have any experience with therapy before. So how can I support you during this time? It is scary if the family is not, this is their first time, we take into consideration their level of acculturation, how their immigration journey was, all of that stuff plays a part in it. So how do I support you? What are your expectations from therapy? What do you know? Can I, help you understand anything? So in that process, you assess their fears, their expectations, their goals. And that's how you get also that question, oh, I hope you fix my child, right? I hope you're able to help us here and fix everything. So you'll gauge that in this process. So I'll ask Nahil, Lily, Dr. C for their input on any of this.
When I engage with parents for the first time, I really try to also get to know the parents. I'll ask questions about, what they do for a living, what does their home look like, who lives at home with them. So as much as we want to focus on getting information about the client, it's also really important to engage the parents, explore what they're going through, maybe how the behaviors of the child is affecting their family and them as individuals. And I also really do make a point to let the parents know the process of therapy and how important their role is in helping their child with whatever behaviors or symptoms they may be going through.
Thank you, Nahil. I'll add to that, even in the questions line here, right? How can I support you and what are their expectations? Because I do want to hear from them what their thoughts are. We might have already in mind a path, sort of a process, just how we do things with, you know, in a routine manner. But it's important to be able to pause and ask them, you know, what brings them here? How would they like support? What would that look like? Because some parents are the type that are like, here's my kid, fix them. And others are like, I need help, right? And sometimes we, because of even our first question, the nervousness of like having to talk to the parents and us thinking 100 million things about ourselves of feeling adequate or ready or prepared enough to be able to help a parent, that we tend to sort of leave them on the wayside and really just help the child through some of these things versus really connecting with the parent and finding out what support would look like for them. And sometimes they'll be able to tell you, like, I want to be the one led. I want to help. I want to learn. So just asking the questions would be another way of building that rapport.
Okay. Yeah. As going back to what Yvette was saying in terms of acknowledgement, I know that I've needed to adjust, and this is probably a part of my not wanting to do things telehealth, because for years my process is meeting the parents, speaking to them in the usted form, being really clear, you know, that I'm speaking to an adult. It doesn't matter now that I'm older than them a lot of times now, you know, so, but being able to do that, and not being formal and not going directly to the kid without first, I might do it quickly, but I might do it first. Basically, so I'm getting permission for them, just like remembering that this is a family system, and are they even used to getting that respect? If they are, they're going to be very insulted like that case, right? Other times they're used to taking the back seat. It's like, wait a minute, you guys are the parents, and I'm going to challenge you to take charge, to provide, you know, later down the line. This kid is acting out. They haven't had structure for a long time. They're in charge. They're bilingual. You're monolingual, you know? So being able to keep that in mind. And also I'm modeling for the kid, hey, your parents might not be perfect, but I'm respecting them. Okay. And so I'm just doing that, and they're here with you. You know, you might think, oh, they're terrible, right? However, it's like they're caring enough for you to take time out of their day, out of their, etc., to bring you here. Okay. Well, I don't know what happened between home and here. They might be totally complaining about it or something, but at least here, okay, giving them that space and that respect. Because also remember, we can't see that kid, and who pulls the kids out from therapy? The parent, for valid or invalid reasons, right? So I don't need to, you know, give the parent an idea of, well, you need to pull my kid out of therapy because I don't respect you or don't understand, or I'm trying to change you. Because also the word acculturation, right? Acculturation tends to be defined by the, you know, culture and power as take away and replace. Okay, as opposed to bicultural, multicultural, it's like blending. Okay, so being able to see, you know, that even persons on our staff that aren't from the culture, well, you're becoming bicultural, you're becoming multicultural, right? And so it's not just sensitive to it, but knowledgeable, and doing it in that way and appreciating it. Just as, you know, those of us that are Latino, you know, or from certain cultures, it's like, okay, it's really easy example. You're leaving a party, right? I'm not talking 5 or 10 people there. I'm talking about a party. There's 40, maybe 70, maybe 80 people there. It's just a party. This is not a wedding, right? How long does it take to leave that house once your partner says, okay, we're leaving? At an Anglo party, how long does it take? They're gone when they leave, right? They might not even tell anybody they're leaving. It's like, oh, we got to go. They're gone versus we got to go. right? What, Nahil? How long does
I
it
was
take?
gonna say, takes forever.
It takes a long time. And one of the persons is like, how come we have to take so long? Didn't you grow up with this culture? Dude, usually, right? Right? You know, I'm able to leave a party fairly quickly. My wife, no. Is she doing something wrong or bad? No. Right? Because you got to acknowledge all these people, right? Respectfully, and you're showing care for them, etc. And so it does take a long time. What? And somebody's at the door saying, "What's going on?" Oh, that person's still saying goodbye. Yeah. Say, well, let's talk then. We're gonna have some time here. Let's talk. Let's catch up. You know. So you see, it's we smile about it because if you don't do it, it's like you're being disrespectful or you're being uncaring, right? And one of the basic things that these people want to know: can I trust you to take care of my kid? Can I trust you to take care of my family? Instead of trying to, well, quote, fix it, which means make it no longer recognizable as Persian, Indian, Guatemalan, Colombian, Peruvian, right, whatever, right? So being able to keep that in mind, as well as the power dynamics, the reality is that the parents are in charge, right? And we're helping them transition to lend me that power. Because when your kid's with me alone, I'm in charge. And you need to be able to trust me that I'm not going to turn them against you, right? So being able to do that, and then when the kid's alone with us, right? Who's in charge? That kid better not be in charge, or they're going to get more anxious and they're going to act out even more and use us, right? Unhealthily, and say, well, my therapist said. It's like they're twisting it. Your therapist didn't say that, but the parents don't know that. But if the parents don't feel that with you, they can say, hey, my kid said this. Well, let's talk about it, because that's not what I say to my clients. Or it's out of context. It's not, you're not getting the full picture. Right? So yes, there's a lot more to it, and we're modeling a lot of stuff. All right. And it's very important to see. It's like, and I take that, it's like there's so much that if you know the culture, there's stuff that you learned that you couldn't learn in graduate school. You learned it by these other social situations. And yeah, a lot of stuff you learn in social situations. I won't tell you my stories about, well, that was really inappropriate. That was really machismo to the nth degree and really, really freaking unhealthy. Nino. It's like, but so being able to, there's so much that we learn, right? And so being able to take and pull out that part that is healthy and beneficial, right? And intertwine it with what we bring into the session, or even in the beginning or the end of it, right? Like getting the kid back to and just like also, I don't like it personally, and I've experienced it. The parents will drop off their kids and they don't even check out the house. They don't even check out who the heck are the people taking care of my kid for Boy Scouts or this or that or the other, or much less overnight. And you've never met the adults in that house, right?
Yeah.
So, okay, back to you, Yvette.
All right. Thank you, Dr. C, for that.
And Nahil.
Nahil.
Yvette, before you move on, I've got 2 comments on the chat. Brian has to say the last common factor study I read, which was a meta-analysis, shows that 30% of treatment outcomes are directly related to the therapeutic alliance and rapport with caregivers and clients.
Mhm.
And then Lucinda also said, I think using appropriate vocabulary too, coming from a master's program where clinical terms are used and the caregiver's education level could be different.
Right on. Yeah. Yeah. Thank you. Thank you for those comments. Definitely. We have to consider those things too. All right. All right. So how do we, one of those things is you have the child, and the child, like we said, they're not your only client here, right? They're our primary client, but we have to also extend these services and have these, stay connected with the parents. So together we can accomplish more in, when it's possible. Like Dr. C said, there's some parents that definitely don't provide the healthiest environment. So I think on a case-by-case basis, you have to consider this with your supervisor as well. But staying connected with the parent is important. So how do you continue to engage them, to continue to have them as part of the conversation, as part of the treatment process, and keeping them engaged so they feel like, I'm also supporting my child. How can I support my child? So you want to help the caregivers understand their contributions and the value of them being involved, right? Versus here's my kid, take care of them. No, I need you to be involved in X, Y, and Z way. Sometimes you need to really spell it out for them, right? Be on top of them, make sure that this child is coming to their appointments. Can you, if it's live session, drive them to an appointment, be here, making sure that they log on. So what the value is in that. And also maybe scheduling your collateral sessions with the parents ahead of time, letting them know during your initial session, your first session, okay, I want to meet with you. I have some interns that meet with the parents every week for 15 minutes. The last 15 minutes of session, we're going to talk. I'll let you know just how the child is doing, not disclosing any confidential information that the child told you, but just, hey, your child is doing well. They came to session, they were on time. This is how you can continue to support them. How have they been behaving? They can tell you all they want. And that's the information that we want too, right? We want them to tell us, how is the child doing outside of treatment, outside of the therapy session? So having that, and also letting them know, that schedule. When do you want to see them? How are you going to organize that? Then that way they can plan that out in their routine as well and in their schedule. An ongoing collateral session, we need that as, that follow-up and that support, the weekly contact, group text. I know I've heard people that do the group text, and the supervisors also recommend that for certain clients as well. Having them, that means having the parent and the child both in the same group chat. So if you're going to send any appointment reminders, you do it together so there's no scheduling issues. And you want to communicate with the parent when there is a scheduling issues, because we do have those parents that say, communicate with my child, they're 15, they are in sports and they do all these things. You communicate with them and arrange a schedule. Well, if there's any issues, once you arrange it, let the parent know, involve them. They miss a session, let them know. The child is consistently late, let them know, right? Any other feedback from that one?
No.
Good.
All right. So we are moving on then to what happens when you meet one-on-one with that reluctant child. We go back to that building rapport phase. Is it the language? Are you speaking the preferred language of the child? What language they speak? What makes it easier for them to communicate? That trust, I think it's difficult, and I've heard it from other therapists, when you're using an interpreter during session. It can be done. You can build rapport and trust. It does make it harder to do, right? When you're having a third person in the room. But just be aware of that. Ask about what their preferred language is. Don't just assume that, they want to speak Spanish or that they want to speak English. And we go back to that respect, that courtesy, and, asking them. Also ask the child, how can I support you through this? Why do you think you're here? What are your goals? What are your expectations? What has been your past experience in therapy? We want to know what their thoughts about all this is, how they feel about it, instead of getting right away to all of the questions and the PHQ-9 and all this. So all that is important, but we're starting off with, why do you think you're here? What brought you here? How do you feel about that, right? And acknowledging that, validating those feelings that come up.
So when meeting with like a reluctant child who may not want, might not know why they're in therapy, maybe helping them understand what therapy is, how you can be of assistance, really being, providing that safe space for them, helping them feel comfortable. I mean, with little ones, especially elementary school age, just playing a game with them can really break the ice.
So
Lily?
move on. I'll bring up the next slide.
No, Lily, any comments, Lily?
Lily? Any comments?
No, I think you guys covered it. Yeah, thank you.
All right. That triggered me for a couple of things. One is, like you said, speaking their language, and for some kids, especially with certain environments, are used to a lot of slang, right? And speaking very roughly, right? You know, maybe very, very crudely, and being able to not respond like, oh, wow, you're speaking, you know, it's like, but being able to let them know, you can speak however you want with me. However, you'll notice I'm not speaking back to you that way. And what I've noticed in time, especially with teenagers, after a while, they start catching stuff and they start apologizing. I never asked them to apologize, but they realize, hey, one thing is cool, another thing is disrespectful, you know? And so being able to, you know, get to that's like a part of it, especially if like they're here because they have this issue with authority. And I get it with some authorities that are jerks or et cetera, right? But wait a minute, those persons aren't. I don't get the sense that your grandma is a terrible person. Just a question, do you speak that way with her when you're around her? And what's her reaction? Well, everybody in my house does that. No, I didn't ask you that. What's her reaction? You know, so because having them be conscious of certain things and being able to do that, because I've noticed there's quite a few persons out there, professional, but especially paraprofessional, and they're so into being cool that it's like, wait a minute, you're dressing like you're in the hood, from the hood, and you're a teenager, and you're like in your late 20s. You know, it's like, well, it's not. It's like, no, you notice they'll respect you. It's one thing to like you, another thing is to respect you. Okay. And it is cool to break rules. It is cool to not have structure. But being able to remember, a lot of these kids, because of that lack of structure, they're filling it in and they're actually more anxious down deep. Okay. So being able to, you know, provide that, you know, and thinking back, if you guys remember being in school, it's like, how is it that really square teacher didn't have very many kids at all acting up in his or her class? That old, you know, stuck in way back this last century teacher had rowdy kids that were not rowdy in their class. They didn't speak slang. They didn't do this. They, in fact, might have told them about their slang, you know? But what they did, they engaged them in a very respectful way, and they didn't have to tell them to shut up or don't be disrespectful, etc. It's like they're like, hey, they're just basically being them and allowing them to be them and say, but they're modeling something perhaps different. Okay. And so, and also I know with kids, not all of them, but with kids, especially teens who are used to being involved with the system, DCFS, that's, you know, that question, experience in past therapy, like they know lingo, they know all this other stuff, and they know that there are people that pass them on, they don't care about them. So I tell them something, it's like, have they ever had this thought? Hey, confidentiality, this is what it means, right? Can't break it unless these three things, etc. And also, I have a policy. I have an insurance policy. And if I break this confidentiality, you can sue me, and my policy is for $3 million. I'll get in trouble with, you know, my license, and I'll also, you know, the policy will have to pay you out. Who's ever told them that they have power, that they have recourse, right? And there's so many people in their head are probably like, damn, there's a lot of people I could have sued or should be sued, right? Much less ought not be doing this. So being able to keep that in mind, again, like not like with everybody, but with certain people, know it's like, look, you know, there's a reason I'm going to respect you, and I mean this when I'm saying it versus I'm just saying it because I got to say it, right? So being able to let them know that, you know, you have recourse, and I'm not going to do that because it won't want to get me in trouble, but it's not going to help you get better, because how can you trust me if I don't maintain this structure, right? These parameters. Okay, so we can get in trouble too, right? Doesn't that a lot of kids say, but it doesn't matter, you can get away with it, you're the power, you're the man, which is probably hard for these women to take. It's like, one, I'm not a man, okay, but you know what I mean. It's like, well, what do you mean? Just call me a man. Okay, back to you, Yvette.
Thank you. And I think Brian had his hand up.
Oops. Let's see, what was it? On that one. One thing that I like to do is I'll ask them, what do you guys like? Get a favorite song, and then bringing.
Oh, your
that up in
volume
that
is
session
low.
lets them know. Let me see if I can fix that. I apologize. Any better or still worse?
Better, better.
I could just type in the chat. No problem.
Okay. All right. Thank you, Brian. I think there's a reception issue. Okay. All right. So as he's typing it in, I'll move on to the next slide. Thank you for sharing. All right. So building rapport. Sometimes we want to, more concrete things. So Dr. C shared some things that he says. And a lot of times, like, what do I say? The child doesn't want to talk. You have your 7, 8, 9, 10-year-old who's just sitting there and is answering yes, no to your questions. We want you to think about getting out of your clinical head. We talk about like all this language that we use and these professional terms and these clinical terms that we, are so used to in the program using now. But you're engaging with a child. You don't want to minimize or to be degrading or demeaning to them, but you want to just use your non-clinical, your terms and talk to them about things that you can engage them with. And the next slide will have really specific things to engage them with, but just think about when you're talking to a child, you're talking to them a bit different than you're going to be talking to an adult, then you're going to be talking to, one of your supervisors or your colleagues. And try to engage them as much as conversation as you can. But keep in mind that kids are not linear, right? They have little tidbits of all random facts and shows that they watch and things that they did, they're going to throw at you. So understanding that process and their magical thinking that comes in when you're talking to them. And what do they want to talk about? They're basically a little one is going to, you want to let them also kind of lead that conversation and talk about things that interest them in the beginning a lot to build, you're continuing to build that rapport. If it's okay with Nahid, Dr. C, and Lily, I'll go to the next slide and then we can dive deeper into this. Okay. All right, here we go. So I know we had, there's some, we can have more discussion here as to what exactly, hold on, activities we do to engage the little ones. So asking about their favorites, engaging them in conversation, even if it's non-linear, like I said. What is their knowledge of feelings? And I think Lily, you can go into that a bit. Using books, materials to engage them, using projective drawings and virtual games. Even though we are not live, there's certain games online that you can play with them and screen share and things like that. Nahili, you want to go first?
Sure. I think when it comes to engaging the young children, I'd like to ask what shows they're into. Because I have young ones, I have a pretty good understanding of what's out there. So usually it's easy to be like, oh, I know what that's about, and really kind of talk to them on their level. I also love utilizing books and then asking them questions about, the specific book, what they learned, what they liked about it, what they didn't like about it. So just really anything that can be at their level, I think really does help keep young children engaged.
Thank you, Nahil. Going into and talking about the knowledge of their feelings, I feel is something really important to be able to kind of get a baseline for when we're meeting with really young ones. Going back to Yvette's comment about how kids thinking, the way they think is non-linear, we also want to think about and she mentioned magical thinking, which is definitely, within this age range, and thinking about how the part of concrete versus abstract thinking for them, right? And they're still more in the concrete portion. And sometimes the way they explain a feeling is just very absolute. Like I was happy, I was sad, I was mad. Like that's normally the range, right? So being able to explore sort of what their baseline is for feelings, and being able to work in a couple of additional feelings into their vocabulary will be helpful, so they could sort of start gathering just knowledge in regards to, they might have been really angry, but they were actually really hurt because, you know, their sibling did X, Y, or Z. So really kind of gauging that emotions, feelings part of it.
Right, thank you, Lily. Dr. C, oh, Dr. C stepped away. Dr. Cardenas, are you there?
I'm here.
All
I
right.
just was messing with my camera. Let's see. Does that work better?
Yes.
Because I lost my green screen or whatever the heck that was. Anyway, so along those lines, I really like the idea with especially young people, but even adults, because again, in my head, every adult is a kid, you know, and especially with certain emotional issues, they're stuck. They go right back to that spot. So that idea of favorites, I really like that word, favorites. And even if they're like in a very negative spot right now, it's like, well, there probably was a time that they were not that negative and they had a favorite. What did you used to like? I don't like anything. It's like, no matter what you ask them, right? It's like, what that year-old, you know, age person doesn't like that character, that activity, or that movie, or that whatever. It's like, and they're like, oh my God, like you said, pulling teeth. It's like, this is two-handed pulling teeth, okay? So, but meaning to say, well, maybe there was something before. Tell me, when you were that age or whatever, what was your favorite? What was something that you used to do? And it may be it triggered that it's like, well, I know that they're here for this, right? This loss or this change. Well, how about before that loss or change? Tell me about that person. What was your favorite activity with that person that no longer is around, that died, or whatever, you know? Or so being able to talk about something positive is very difficult, even if they don't talk about it. Now we've triggered a positive memory and emotion, okay? And we're valuing it. Versus so many times, you know, what they're used to, especially kids that are now stuck in that pattern of all they do is get in trouble, get in trouble, and get in trouble. And it's like, so they don't hear from people that really care about them, that there's things that is, I'm glad to hear that you like that. Tell me more about that, right? So being able to engage that and them to have that positive feeling connected to us, as opposed to, this is a person I'm seeing, they don't know anything, another stupid person that wants to fix me or tell me I'm crazy or whatever, as opposed, no, this is a person just like, you know, and say, I just want to get to know you. Let me get, you know, I'm gonna give you all these questionnaires, but I'm gonna try honestly about getting to know you better. How's that? Let's use this time. Okay. So like you said, you got bring it into real, just simple person-to-person talk, not I'm your therapist, you know, you're going to learn about, you know, enmeshment and all these, you know, words that, you know, are professional verbiage and terminology. It's like, nah, you can learn all those words and still be just as unhealthy as before. Okay. So being able to find out, if not present favorites, past favorites. Okay. And then they open their mouth and we're not pulling teeth, they're not talking. Okay. Or at least thinking and getting us to be associated with, hey, this person really does care, right? About what I think, not what my parents' favorite is, right? Not what my parents necessarily, not that we won't get into it later. I might ask them later. It's like, I want to find out what, that's the homework, right? Tell me, what were your parents into when they were your age? Right? So back to you.
Yes, Naheed.
So before moving on, I just wanted to read Brian's comment. Asking them about their likes and bringing it back. Ask about a favorite song, listen to it and play it next session. They tell you about a birthday, ask them how it was next session. That's huge for them. Be consistent. A lot of kids have been let down over and over. Being someone that always shows up is again huge. Last, if appropriate, don't be afraid to use humor. Thank you, Brian. Those are really great suggestions.
Thank you, Brian. And that's something, you know, as you guys are talking, that consistency is really important. And sometimes maybe the kid is not consistent or the parent's not, but you are. You are that consistent person in their life. That's why we try to schedule the same day, the same time every day. Consistency is key. So you are going to be that person that they rely on. And as you're doing this, I think as you're talking, as you're playing games with them, I love the idea of playing music with them, because some of them, and we'll get into the teenagers a little bit later, but they really love music, even kids at this age, right? You have your 7, 8, 9, 10-year-olds who are listening to all kinds of music on YouTube and watching the videos and stuff. But what does that do for them, right? How do they feel? At least you can explore, you know, what they like about that song. How do they feel when they play it? And as you're playing the games, as you're doing that, what came to mind is we're doing a lot of observations of their body language, their affect, the mood changes, how they're describing things, how they're expressing themselves. So you're not just playing games, you're still the clinician and you're still making these observations. Okay, so, okay, let's see. And now we'll next slide. So one of those things that comes up that we need to do is our assessments. But how do we elicit the information from little ones to, you know, do the PHQ-9 and the GAD-7 and the ACEs and all these things that we're requiring to make a diagnosis and to figure out where they're at, what symptoms they're having. So we want to talk to the parents. We want to have those collateral sessions, get them involved, ask them the answers, and they'll answer to the best of their ability. But you're going to gather some of this information through your play, through those, you know, the activities that you're doing with the kids. And how do you ask the children about their feelings, that sadness, right? So I wanted to really open that up and see what tips, you know, other supervisors and even you as trainees and interns, what has been your experience to elicit these feelings of sadness, anger, their anxiety, all these symptoms? We'll start with Nahil.
One of my favorite games that I used to play with my younger clients would be Candyland, and assigning a color to every feeling and then having them kind of switch it around. Like, has there been a time you felt angry? And then, you know, they'll answer, or what do you think might make, you know, a person angry? It's just really, I like doing it through games, especially with the younger children.
Yes.
Thank you. The same here. I think Candyland has probably been the go-to for feelings. In eliciting sort of like anger or frustration, I use Trouble. I used to use Hungry Hippos too, and just because it's physical, but as well as you start to see sort of a lot of that buildup of wanting to win and how they get frustrated when they don't, and that was helpful. Now, when we're talking about currently, right, if we're meeting online, how are we eliciting some of that? And, you know, on the previous slide, one of the things that did come up was when we noted virtual games. Now we want to be really mindful and careful of not engaging in games where they're seeing like, it's an actual virtual game where they're seeing like your user player name and whatnot, because then that can lead to all sorts of other down the road sort of not only breaking confidentiality, but then seeking you out in these game rooms and trying to play out of. So that's not the type of virtual games that we're noting. More in regards to like when you're sharing your screen and you're playing sort of like emotional Jeopardy, right? Or those type of games. But for the younger ones, I will often go to online is having them still tell me about like their favorite cartoon, their favorite show, and really dig into like who they what characters they like. And I like to know why. What is it about that character that really resonates with them? Is it the character that's constantly being mischievous, right? Because they get away with all this stuff on the show, or they really resonate with the quiet one, that sort of wallflower that, you know, doesn't really stand out too much. So really trying to dig into those shows for me has been a really easier way to engage with the younger ones.
Okay, so yes, there's, as you mentioned, you know, getting the collaterals, and with especially the younger ones, it's really the parents are going to be the ones really filling out these forms, the cries, the PHQ-9, etc., and knowing things that happened, and perhaps knowing something that was traumatic that the kid doesn't even quote recall, right? Yeah, when he was 2, this happened. It's like that kid doesn't remember, especially the male, right? Maybe a female age 3 or so, but not the male. But it doesn't mean it didn't impact that system, that family, etc., and help make sense of some things, right? So being able to do that, and I let the client know that, hey, I'm getting this information from your parent, from your grandparent, from whomever, right? And it's okay for you not to agree with it. It's okay to you think, oh, that's BS, or that's exaggerated. I'm not saying that they know the truth. I'm just getting their perspective, you know, and so being able to do that, as opposed to they're thinking, oh, you know, whatever they say, that's all that matters. And now I'm just that bad kid, you know, or stupid, or whatever it is, right? So being able to let them know that they'll have plenty of time when we're alone to give me their perspective. And it's all right to be critical of what these authorities and the other person said. And just because I'm listening to you doesn't mean that I'm all right, you're right, they're wrong. It's just like, okay, I have a different, you have a different perspective. And maybe my job is to help them see it from that other perspective, and where the history is that brought them to that perspective. Because so many kids don't know. It's like your parent, by the time they were your age, they had been working for a long time. They were not, oh, I get to get up and go to school and that's it. You know, they were working, right? They were taken care of, right? And so they have a whole different perspective on what persons are capable by your age, right? So being able to keep that in mind. And then, as you guys are saying, these different things, instead of just asking them questions, in terms of getting them to do things, because different people are, they're multimodal learning, right? They're visual learners, they're physical learners. If you get them manipulating things and doing things, it's going to facilitate them now speaking to us, talking about stuff, right? And so being able to, you know, do that play therapy or activity therapy, and there they go. They're talking about stuff because they're not so focused on being guarded with, I can't tell them this, you know, etc. They're distracted in a way. And so they're now more open to us and answering our questions, or following along with, you know, with us, because we're now not as dangerous, right? So being able to do that, you know, and again, that persons of color, we know that they're not just about talk, it's about learning in all these different modalities, right? So let's use them. All right, Yvette.
But before you move on, I just got 2 comments on the chat. Roxanne put the therapist aid has good children's videos. And then Brian also put, I love using an emotion wheel. Have them pick 5 emotions and assign a color to each emotion. Have them draw a heart, and then have them color the heart in which how much they feel each emotion on that proportion. You can do it for the day, the week, towards mom, themselves, dad, the night the trauma happened, etc. You can also use it as a visual representation of how it changes over time.
Great ideas. Love them.
Just really quick, if I could add, since we're talking about completing the assessment and gathering information for our screenings, is, you know, obviously the younger the children are, the more information we're going to want to gather from the parents. Not to say that we discard the kids, you know, automatically, obviously gauging how old they are, their level of understanding. And you might not ask the full questionnaire, but you can still use certain questions to sort of gauge where they are with either some anxiety or some depression or certain questions from the ACEs, especially if we're trying to figure out like, not to cooperate with the parent is saying, but just to sort of assess what their understanding of that is. So that's just another way of being able to, how to get the information for these forms.
Yeah, definitely, definitely. And you have to consider all of that. And it's not easy, and it might not be easy to gather a lot of this information, quickly. So I think being patient as a provider and having that conversation with your supervisor, getting that support, I think there is a lot of pressure to complete the assessment, do the treatment plan fast. And, in most cases, you may be able to do that, but there are some cases that are just going to be a little bit slower than others, and understand that and communicating that and figuring out strategies with your supervisor and in group supervision about how to go about it too. All right. Okay. All right. So we're going to go into the adolescent piece. So, a lot of the building rapport is going to be the same, right? Focus on what they want, why are they here, being respectful, being friendly. And I think with adolescent, like Dr. Cardenas was saying, is letting them know you're not here because, they're in trouble and that, they need to be fixed, that they're a bad person. I think getting to understand, and that getting them to understand that you're also keeping confidentiality here, unless, of course, you are a managed reporter and you're going to go through all the limits of confidentiality as well. But having that understanding that you're there to support them, you're there for them, and not necessarily because you're going to go tell on them and go tell their teachers in their school and go tell everything to their parents. I think with adolescents, that trust goes a long way. They've had a lot of trust issues. They might have trauma, so take that into consideration. So we want to focus basically on where they're at the moment, how they're doing, and respect that. And what are their expectations, and what are your expectations? Setting those really clear, that clear understanding. That goes back to the time, how long sessions are going to be, how frequently they're going to be. They want to know that. Maybe they don't play sports and have all these extracurricular activities, but it's still their life. And we want to treat them as with respect, right? You would do that for an adult. You would tell them what the expectation is. Say, I'm coming in, our sessions are going to be 50 minutes long once a week. You do the same thing with your adolescent. And then I'll open it up to see if anyone else has. Nahil?
The only thing I'd like to add was that treating the client with respect, but also treating their resistance with respect, like acknowledging that this is difficult and I'm a stranger and really I'm going to take it slow. I'm going to try my best to make you feel comfortable. And then, when we're working on goals, making sure that these are things that they also want to work on. Sometimes we go in with, okay, there's behaviors and symptoms, and okay, this is what I want to work on. But do we ask what this adolescent would like to work on, or what they'd like to focus on, or any specific things that they want to talk about? So just being very mindful of that.
I like that. Thank you, Nahil. I feel like that's a lot of it.
All right, Dr. C, any feedback? You're muted.
So just piggybacking on what Nahil will say in terms of valuing their being careful, right? It's like that, and then restating it's like, well, their reluctance mean, hey, you're being careful. You're not just going to open up to me. Who am I? You don't know me yet. And so, hey, that tells me you care about yourself, and that's good. I want to help you healthily care about yourself, as opposed to, anybody asks you a question, you're going to answer it. Anybody wants you to do something, you're going to do it. It's like, that's really dangerous. Okay. And it doesn't matter, because plenty of therapists that have abused the clients. So You know, it's not just automatically, you know, it's, you have a certain title or look a certain way, you're safe, right? So being able to, it's like, hey, that tells me you care about yourself and you want to be careful. Good, that's good, you know. So as opposed to, oh, you're difficult, you don't want to cooperate, you're just a difficult person, you know. It's like, no, let's look at it differently. So back to you.
Thank you. And so, you know, we go into the, you know, we've talked about then demonstrating your trustworthiness and authenticity in the session as your beginnings to build that rapport. Consistency we've discussed, and also being non-judgmental. Pay attention to those nonverbal cues that they're giving you at the same time and that you're giving as well, right? If your teenager says, hey, I smoked pot last night with my friends, like, right? If you're shocked about it and like really like, oh my God, what were you doing? They're not going to, the likelihood of them telling you anything else is not good. So it's going to be pretty low. So you want to just, yeah, you know, we're looking out for their best interests, but we want them to see us as a supportive person, and we want to be authentic about our support that we're giving them in a non-judgmental way, being transparent as well. So if they do tell you, you know, something that they're not supposed to be doing, something dangerous, you've reviewed limits of confidentiality before. You know, they, you know, and this is a reminder for them, hey, you're doing drugs, you're doing, you know, things that are harmful. Yeah, you're gonna maybe be more direct at that point to help them. So, you know, that's a huge risk. So, you know, keeping that transparency instead of beating around the bush with things. I think with adolescents, I think they'll appreciate that more than you kind of tiptoeing around things. And I'll open it up. Nahil?
I think I don't have anything to add to this one. I think you nailed it.
Okay. Lily, anything?
Yeah, I think for me, the part of like, and I know we said consistency has been key. I feel like for me, building rapport with a teenager up front is really like setting up what the structure of our ongoing work is going to be like, right? And I probably remind them of that, like the first 3 sessions of, does this time work for you still? Like, this is your time. You know, showing up on time. If I happen to need like an extra minute to log on, or I'm wrapping up with someone else prior, just to give them the courtesy of like the heads up, like I'm logging in 2 minutes. Thank you for your patience. And then anytime going into, I think Dr. C mentioned this and you that early on, is being able to connect with them right up front instead of just consistently going straight into business, right? Like, hi, how are you? And looking at your notes from last week, like what were we supposed to be looking at? They mentioned a birthday, or they were attending, their grandparents' 50th wedding anniversary. And we start like, hey, I know you went to your grandparents', like, so they know that you are present and paying attention and following through. I think that really helps stay on building a rapport and staying connected.
I want to add on to that, Lily. Anniversaries of maybe the death of a loved one is going to be important to bring that up and acknowledge that when they mention that to you. Dr. C, anything?
Yeah, in this part, I'm thinking, early on, and I do it much more now than I did before, I might do some little things like, take a breath, or close your eyes and just do this. One, I'm testing, do they trust me yet? How much? And then the other is like I'm modeling something and saying, do they even notice, right? That they're like, they get ratcheted up, right? And so being able to keep them in that window as much as possible. And for some people, they're used to being outside that window, okay? And so they're impulsive, they're not able to process and, stop. So being able to just let them know, it's like, I haven't formally necessarily taught them, some grounding techniques, relaxation or whatever yet, but it's like, but getting started with that, because, and then when I do it, it's like, they're not surprised. Oh, now you're really showing me this stuff that you guys do, you know. You know, and the thing too is like, as we see out there in movies and all that, there's so much of what we do that's actually in programs and all this stuff. They make fun of it, you know, in comedies and stuff, but the point is like, yeah, that stuff might be funny, but it works, you know, if you do it. So being able to have that, you know, introduction of, you know, and it's also like you said, we're paying attention week to week. We're paying attention throughout the whole session. We're paying attention to them. We're not distracted with other stuff, right? So being able to do that, and because we know, you know, that what matters in person's lives is to combat and quote was what we know about resiliency, resilient people is having some linearity, something, somebody that was consistent and not abusive, consistent, and gave them that hope that, you know, and that everything isn't chaos, everything isn't pain, everything isn't, you know, devaluing me. Okay, so back.
Okay. And he let me know if anything comes up in the chat box. So the next slide. So a couple of tips here, activities for engaging adolescents, right? There's so many things that we can talk about with them. And, you know, we'll need to just remember what that's like, what activities you used to do a lot when you were a teenager. It's been a while, but, you know, teenagers are not going to just tell you their feelings unless they're ready for it. So you have some teenagers that will, but then we have those reluctant ones, and those are the ones we're talking about today, that they're not just going to show up to session and be like, I'm so sad, you know, this and this and this happened. So consider things, if they're being forced to therapy by the counselors, their parents and all that, that'll also play a part in all this. But what activities can you use to connect with them, right? So music, somebody else had already said that, listening to the song together, put it on, exploring their likes and dislikes, their favorites, what's your favorite food, what's your favorite activity, do you have a favorite subject at school, do you have a favorite TV show, a favorite movie, a favorite character, anything goes, right? Exploring likes and dislikes, same thing. And then hobbies. That one, I find the wording, when you ask a kid what their hobby is, they might not understand that, because they think that may think that as an adult thing to do or a white thing to do, right? Or something that's out of their culture, out of the norm. Like, what are you talking about, a hobby? Instead of, is there something, you can word it differently if you want to find out, as, is there something that you like to do? Something that makes you happy that you do. And give them examples. Do you like to do art? Do you like to exercise? I don't know, at school, do you play any sports? So bring out some examples, some realistic examples for them. Take into consideration the school that they go to, what activities there are there. Is there a chess club? Is there a journaling club? Things like that. And, you know, even go into things that irritate you, things that make you upset, because not everything's happy, right? But what also, is there something that makes you upset at home, at school? Best and worst as well. So you'll gain that trust, and it's small. Like I said, we're getting out of that clinical thing, asking all the questions, asking about their mood. What do you like to do? Make it a bit smoother, easier to talk about. And I'll open it up.
Okay, so when engaging with adolescents, I can recall one client who I was seeing for many years, and she was into makeup. And we would start our sessions with her telling me about the latest makeup trends she learned about, or showing me pictures of, you know, oh, I did this weekend, and look at, like, I worked on my eyes, and look, you know, so that was our way of bonding, was just through talking about makeup. And, you know, I like makeup, and she was just so into it that she ended up going to school for it. And then she would come in and show me like the models she worked on, you know, in her classes. So that was a really good way for us to build rapport and kind of engage her, was just kind of focusing on the thing that she was most passionate about.
Thank you, Nahil. I'll add to that. One of the ways that even more lately, so just because our teenagers' vocabulary changes from like day to day, like it's so hard to keep up with like the new trend of, you know, set of words. So asking teenagers to teach me on X is always helpful, right? So maybe it's vocabulary or you know, I love Brian's remark in regards to like, don't be afraid to use humor. Like I will never shy away from it. And sometimes if I'm really trying to build rapport with someone and they're sort of like, I see them on the fence, I'll ask them like, hey, I just heard this new word. Can you explain this a little bit more to me? Like if somebody says they're coming in clutch, like what does that mean? I know I'm super old, but can you help me with that? And they just like sort of start to ramble and tell you and how and where, and they used it. And then all of a sudden that becomes, you know, us coming into a conversation of what's needed, right? Or they're really into soccer and I have like no idea, you know, is it like a touchdown? Like, what are we doing here? And they're like, oh no, well here, and this is my position. And you know, you might know stuff, but that's also a really good way to be able to engage, you know, and so I love, you know, talking about like their love and just what they're into and their hobbies and how they've helped out with one thing or another. And the other thing is like asking them like if they were able to volunteer and do anything, like what would that be? And it tells you a lot about like just maybe a passion or something they've secretly kept and haven't really shared because they're shy or embarrassed about it. That's another thing that I use often. Dr. C.
You're on mute.
Okay, you young people. All right. So aware and I'm not. So as you mentioned earlier, the person comes in and they were doing this unhealthy thing the night before, right? It's like, okay, we're listening to it and being able to see these unhealthy things or unhealthy relationships, et cetera, as opportunities to, you know, to psychoeducate. How much do they really know? Because especially with teenagers, it's like they know, I know, they know. They don't understand. Okay, they know a lot, but they don't understand. They know, you know, about all these different gummies and all these different, you know, methods or ways to get high and loaded on weed in particular, et cetera, but they have no idea the danger and the power what they're dealing with, right? So being it's like, you know, let me talk to you about that, or let me talk to you about, you know, what it means that, you know, here you are, and he says you're so sexy, and you're all this, and you're a minor, and he's an adult. Like, let me tell you about what we're talking about here that you think you know, right? And how it is connected to what happened earlier when you were 8, right, etc. So all these opportunities to like, not to say, you know, oh, you're messed up or that's bad. It's like, well, let me tell you about that. Okay, we're going to go into what the dynamics are involved with this or that or the other. And so because I know that they're being used, right, that they're trying to find a way to self-medicate to feel better, and it's leading to an addiction, right? And maybe they already have an addiction, right? So being able to talk about that, and you know, kind of go after the I know, and to show them, well, there's more to that. There's a lot more you don't know. Okay, and how can we do that? Because we care, right? And then what I've also found is, you know, trying these different techniques, and then you say, oh my gosh, this person's a writer, right? They might not be getting good grades, right? Even in English class, but you ask them to just like, whoa, that's really good. They have a middle, you know, beginning and an end. You know, the story has, it's like they're a really good writer, and they have no idea, right? So they have this artistic ability, or they have these different abilities. And I found that in particular, especially with persons who used to be, right? They're older and they used to be, and it was shut down because there's no money in that, right? And it's like, as soon as I asked them to do that, expressed it in this and the other way, right? They get better because they're now expressing it, getting out their stuff, in their modality. Drawing, painting, whatever it be, right? Artists who aren't practicing their craft are depressed. That's what I found. They're getting more, because they have something, an ability that helps them be aware of their world, right? And connected in a healthier way to their world. So, and that's the thing too. It's like, and sometimes, you know, they have that and they were told by their loved ones to not do that. It's a waste of time, right? Or like that. It's like, yeah, they're a fantastic soccer player, but their family's like, no, you know, we're here, you're going to play real football. And they're like, but I love football, all right? It's like, so being able to say, well, that's a passion of yours, maybe not a hobby, but a passion of yours that perhaps we can find a way that you can develop it, right? Later, because it allows you to be more you, right? So, yeah. And then just lastly, like you said, the questions, these magical questions, if you could, if it weren't a question of money, if, you know, what would you, right? So being able to ask those magical questions, because you're not going to laugh at them and let them know before they leave. And I don't want you sharing that with these other people, because they might say that's stupid or might laugh at it. But here, let you know, I'm not. Okay, so
Thank you, Dr. C. We're gonna have to move a little bit faster now.
Before you move on,
Go ahead.
sorry. So Brian says making slime is a pretty solid for most age kids. Even adults like myself love it. Another popular one I've done is would you rather, a great icebreaker and an engagement builder.
Great tips. Thank you. Okay, so we'll move on a little bit quicker, so you'll hear me talk a little bit faster now, because we have some slides left and about 30 minutes left. So I want to make sure that we get through the whole presentation. All right, so we go into, did we already talk about this? Yeah, so same thing with your screening tools. How do you elicit the information that you need for your diagnosis, for your, to get information about their symptoms or behaviors, right? Well, we go back to building rapport with that caregiver, but also with these questionnaires, depending on the ability of your teenager, the teenager may be able to answer these questions on their own. But what I would do, I would highly recommend is you do it with them, because they may not understand the jargon in the questionnaires, or they may have questions, or may not understand them completely, and that has happened. We even have that with adults, right? So just keep that in mind as we move along. Okay. Any Dr. C. Lily Nahil? Okay. All right, so what I want to talk about is structuring that initial session. So we usually in supervision have these conversations. So we want to give you a reminder that it's not easy to have these initial sessions. So just a little layout of what it typically looks like. So you have your greetings like we discussed, right? And we're virtual right now. So ensure that you are verifying your client's location, where they're currently at, and their address. So, and that goes for every virtual session that you have. Don't assume that they're at home. If they're at grandma's house and they're not at home, get that grandma's address wherever they may be, because in case of emergency or, somebody expresses suicide ideations, you need to call 911, or something happens, you need to give an address for the paramedics or the police, whoever you're calling. All right, so you go into verifying that, then you're going to review, of course, your limits of confidentiality and other initial disclosures, as we've discussed during orientation, right? Follow your BBS law and ethics. And you're going to want to disclose this, as a reminder, with the parent and the child. Verify that they have privacy when you're talking to them. Is the entire family there? Are they in the car driving and all the siblings are sitting next to them? Right, take that into consideration. Structure and expectations we've talked about on both sides, right? What are their expectations? What are your expectations? What that structure and session going to be like? So you're going to say what to expect during your sessions, what to expect from you. How do they How are you going to structure your collaterals with the parents? What are you going to do? Are you going to see them? What are you going to talk to them about? Right? What are those conversations going to be like? So you want to express this with your kids. Schedule attendance. Ensure that you are explaining to them, we are going to meet weekly or bi-weekly, whatever you decide for your specific case, what their specific time is going to be. What are you going to do? How are you going to communicate if somebody needs to cancel or you need to reschedule? Where are they going to reach you? At what time? What day? What day are you in? Are you available 24/7? Right. So these are things that you tell them ahead of time. They know what to expect. Remember, we're going to be consistent here, and we're going to set those limits, those boundaries, and those expectations. Screenings and goals, you're going to review that. And of course, as much as you can, this takes a couple of sessions for those screenings and to develop the goals. And of course, homework and having your closure. Some of the tools that you can use as you are gathering this information, of course, your therapist resources are your genograms, your timelines. You're going to use psychoeducation as you're gathering information for your initial sessions and educating them. Books are available, as we've seen during our last didactic, any resources, other resources, and homework. Resources also as far as warm lines or hot lines that they may need. This you can do as you're initiating your sessions. Nahil, Lily, Dr. C?
One thing I'd like to add is that I love using timelines because it gives me a really good foundation about the client's history, what they've experienced, when they experienced it, how they feel, how they feel about the past traumas, past moves, just their home life as young kids. What is home life like now as a teenager? So it really does help me gather the information that I would need to form those treatment, to form the treatment plan, to develop goals.
Hey, Lily?
The only thing I'd add to that is I use the genograms to gather a lot of information for my assessment. So you can use that as a tool as you're gathering information, knowing about the family, who's in the family, who lives where people are situated, who's together, divorces, etc.
Yeah, I would just iterate here, adding with privacy issues in terms of, especially with young kids, but even with some other persons, we're doing like some women at downtown LA. I'm blocking on what it is. Anyway, not Posada. Okay, in terms of helping with that privacy and attuning, is that we're open to assessing and getting them headphones. Okay, which helps them have a little more sense of privacy, because there are some kids that we're seeing and they're in one room. Okay, when they're at home, and so they don't have an option to go into another room, etc. So being able to just provide a little bit more of that availability, at least they're not hearing what we're saying, right? And the other person around them and stuff. So just know that that's available, and then we can get that to those families. Besides the fact it also helps them with their schooling. So yeah, that's it.
You. So, for your ongoing sessions, a typical format looks like this. So it's your greeting, grounding, especially for those anxious clients. We'll do some grounding. It could just be as simple as let's take a deep breath, center yourself, and then you do your check-in. Processing is what we call then, how are you doing? They tell you what happened, how they're feeling, and all that stuff. It could even be like the activities that you're doing, the games. All that is in there, because remember, you are gathering information even as you're playing games. Homework, you're assigning the homework. What are they going to do? And also that could be also a time where you're maybe having your collateral session with the parent and explaining, hey, can you help us do this? Can you support your child in doing X, Y, and Z within the next week? This is what we talked about during session, right? So you explain that homework. You may want to do a closing grounding exercise with them and then confirm your next session. Right? Okay, next slide. So I think a little bit, we just wanted to emphasize the importance, and I think we've already done a lot of emphasizing the importance of structure and expectations, right? We've been drilling this, but it's so important to communicate that with both the caregiver and the children that you're working with. Session times, anything with the schedules with the minor, and definitely ensure that the parents are aware of the session to keep them in the loop from the beginning. So that way also the clinician is not as uncomfortable reaching out to the parent when there's an issue, because you've been having conversations with them. So it's not going to be awkward for you to say, hey, your child didn't attend this, or, you know, or this and this happened. And it makes it more normal. The child, your client, the child also understands that you are in communication with their parent, that this is normal, right? And oftentimes we get, the concern is, well, the therapist may have is that the client's going to see them as colluding with the parent, or maybe distrusting the therapist or that process. But if you do it from the beginning, you get less of that, or you feel as a clinician less anxious about it or worried. Time frames, like we've talked about, the time frame of both, let's clarify, both how long the session is every week and also how long treatment will be, right? Is this going to be forever? Is this going to be for a month, right? So I think a common thing that we supervisors discuss is you can say, we're going to reevaluate in 3 months, right? And we'll talk about it again. You know, how frequently we're going to meet, how long this will take, and how you're doing at that time, right? So that's a reassessment piece. Awareness also of setting those short-term and long-term goals, interventions and techniques used in treatment, and the treatment plan. So having that in mind, your collaterals, your family sessions, et cetera, having that communication with the client, how you're going to structure these things. So I'll give a chance to Lily, Nahil, and Dr. C to discuss anything that came up for them as we're reviewing this slide.
I just have one thing to add. I think the more structure you have in your sessions and being able to communicate it to your clients, the less anxiety they may have about coming to therapy and continuing with their sessions. If they know what to expect, then it makes it easier for them to really be engaged.
Thank you. I agree. And just to add to that, it's part of them is knowing what will be next is helpful. So even ending the session by saying, you know, next week we'll start here, or we'll review X, so that there isn't this sort of element of surprise, like never knowing what's coming in. And the other part to that is ensuring that our questions are very on the open-ended side, as opposed to those concrete questions where the kids are hearing a yes or no response in them, right? And when we're eliciting with the open-endedness of those questions, we'll probably just have them settle into a little bit more comfort of just knowing, and maybe not so much comfort because it might be anxiety-provoking, but for us, maybe that ongoing, they don't want to talk, it's like pulling teeth, everything is fine, or a no, or just a yes. So how do we structure our questions so that there's two-way conversation?
Okay, I'll just add, just because we have here on bottom treatment plan, that for them to be knowing that we didn't just give you these ACEs and the cries in particular, because just to fill it out, because we're doing some research, okay, that we're going to deal with that. And that's going to be on our treatment plan. And it doesn't mean we're going to deal with it immediately, but this is going to be dealt with. And that's a process. And we're going to prepare you to be ready to deal with that, so that you can deal with it and get past it and heal. Okay. So it's like, this is trauma-informed treatment, right? So being able to let them know that we're going to go through those traumas or aversive experiences that other people perhaps have told them a long time ago. Just forget about it and move on. What's the big deal? Okay.
All right, thank you. All right, so let's destigmatize mental health with children and adolescents, right? So we want to quickly gauge what you've heard children say about mental health. And you can feel free to unmute yourself really quick activity to see what have you heard them say about treatment, and you can put it in the chat or you can unmute yourself.
Valentina says, my dad says therapy is for crazy people.
And I bet the children are hearing that, right?
Julie says there's something wrong with me.
All right. Okay.
Roxanne put, am I crazy because I see you? Maria, I don't want anyone to know I'm in therapy. It's embarrassing. And Elena put, my parents said you're going to fix me.
Oh, wow.
Lucinda, it doesn't work.
Mm-hmm.
Marilyn G, am I the problem? I think that's all I got on the chats.
All right.
One more.
Go ahead.
Brian, I love asking them how many therapists they think have their own therapists.
Right. Right. Yeah. So we've heard these common misconceptions, no, you are not crazy because you're in therapy. So, there is nothing wrong with you because you're in therapy. Another thing we hear that therapy is for white people, from our Latino community, for communities of color. It's also not just for rich people. It doesn't mean that you're in trouble. Your parents are not in trouble. There's an asterisk next to that because, mind you, those DCFS cases or those child abuse cases that we get, a mandatory case, right? So I can't deport your family. That's another, issue that we have with some of our cases, is that they're fearful of talking to us out of fear of deportation. As a social worker, they think that I take kids away. That's a common one. So no, I don't take kids away. Asterisk. We are mandated reporters, so we go over that one in their safety. But me, I don't go into your home and take you away. We don't just talk about boring feelings in therapy, and that has been the topic of discussion today. This is a lot more than that. We can talk about anything you want. All right. So quickly, the reluctance. So this is a big one. And I think that even if we don't get into a lot of the other one, some of our other slides, this is one that we want to really dive into. And before we do that, we want to gauge your fears, right? What are common fears that either you've heard in class, in group, wherever, or reluctance that you've experienced or heard of when engaging with collaterals, when engaging with parents, when engaging whatever insecurities that come about. So we have a couple of things here. There's a fear of engaging in collaterals. There's a fear of engaging with family. That fear that I talked about earlier, fear of breaking confidentiality when having collaterals with parents. Any fears that may come about?
On the chat, Valentina says the age difference. Julie said being pressured by parents to say what the kiddos are saying. So breaking the confidentiality. That's all I have on the chat.
Okay. And feel free to unmute as we discuss this, because this comes up, and as supervisors, I think can give all our input on everything that comes up as clinicians. And we've discussed a little bit about it, but we want to just open it up and see if anyone else wants to discuss that, because as a new clinician, as you're in training, there's a lot of feelings that come up. And there's that reluctancy of do I want to even talk to the parent? And knowing what our issue is when we're just like, oh yeah, that parent's really not engaging with me. Is it really the parent or is it you, right? Or that child is really not talking to me. So I don't know if we should close this case because they're really not saying anything and they keep missing session. Is it the client or is it, you know, in part us as clinicians, we'll need to reflect and say, what am I doing or what am I not doing, right, to help the situation? Where is my anxiety coming from? Or am I cutting them off? Am I not asking or probing questions? What's happening? Nahil, you wanna have any other input?
I think maybe as a clinician, sometimes the fear of not being effective may get in the way, especially if we have a very resistant client. Like, what do? I don't know how to reach them. Is it something I'm doing that's causing this client not to talk? So I think those are some common fears I think any clinician can have.
All right.
Valentina put imposter syndrome as trainees.
Right.
Right. It takes us a while to be able to kind of come into our own and not only know that we do have the knowledge, but walking in, right, in the sense of like in the past we've been present, but opening up these Zoom sessions and listening to some of the parents or the clients say things that we really don't know how to respond to. And part of that fear is like, if I don't know what to respond, then, you know, am I effective or am I in the right field or whatnot, as opposed to learning how to be okay with not knowing everything in that moment, learning how to pause certain conversations and say, you know, that's a great question, and maybe posing it back to the parent and saying, how do you think that would work if, you know, how would you see that changing, or what would you like to see different? Because we don't always have to have the answer, right? Some other fears is, and I've heard this often, is when the parent says, can you tell my child X, Y, and Z? Can you tell them that they need to turn off the TV at 9 o'clock at night when I ask them? Right now, we're being put in the middle. We're the referee, and, you know, use the word that you need in order to help the parent sort of be in this hierarchy that they're trying to get in their home. So when we're put in these situations, like, how do we respond, right? But I going back to the imposter syndrome, right, as trainees, and do I know enough? Is this enough? And I think it resonated very much so when Dr. C stated that it's okay to let them know I have a whole team behind me in guiding, right? If I don't have the answer, I will take it back to my team, which is supervisors, and not for them to know and understand that we're not breaking confidentiality, but that there's a whole team behind you that's really helping you be successful. Dr. C?
Yeah, I think for me, what's coming up now is that, yeah, the reality is it is frightening, because we know the numbers, we hear them, and like right now with the pandemic, there's a lot of, you know, kids that are even more suicidal, etc. Right? So depression kills, anxiety pushes people to be crazy, you know, and so being able to respect that. But to me, where I am now, it's like I hate it. I hate depression because it does kill. I've seen it kill. People don't kill themselves. Depression does. So I'm going to do my best to fight it and to go against it, and not be as, well, wait a minute, you know, because it'll take it the opportunity, you know. So there are interventions. That's why we do, you know, that's a part of you know, our confidentiality. We say we're going to break that confidentiality, because I'd rather you have a pissed client and right than a dead client, you know, if at all possible, right? And so, and I'd rather have a person who's, again, angry at me and than I didn't help them get out of that unhealthy situation dynamic, right? Or I didn't give them the tools to be able to be more likely to do that. Okay, so Yeah, so it is kind of frightening, and we do have this position and responsibility, but that's why, again, you're not alone. You know, you have supervisors, we have experience, and we're human. And yeah, it also, just like another fear that it's not there. Oh, I'm afraid of, you know, breaking down in front of my client. Well, all right, don't fall apart, but it's very important that they see you tear up. I've used plenty of tissues with my clients too, but I didn't lose it. Okay. And what did it say? I'm human and you're human. And how the hell is that not going to push you? You know? And so being able to, you know, and when we were live, you know, face to face, every room, and those persons that would come to the office, right? Every room had tissue boxes. And what's in the hallway? A lot more tissue boxes. And they're the big ones. And I would joke about that, right? Just like I would joke about, you know, getting back to the other ones, like this misconception. It's like, do you want me to give you a piece of paper? You want me to get a certificate that says, Dr. Cardenas says I'm not crazy? Okay, I'll tell you, the situation is crazy. Your family's crazy. You know, parts of my family are crazy, but you're not crazy, you're human, you know? So being able to, you know, deal with that, you know, confront those misconceptions straight on and directly, as opposed to teetering around them and saying, you know, that. And I have, you know, and that's, you know, I can tell them, it's like, I've dealt with crazy. I've been in mental hospitals, and telling the people to open the door and close the door, right? In California, in Texas, in Massachusetts. So I know what is crazy, okay? And you're not crazy, you know? And yes, we do work with crazy people, but the thing about it, if you're asking me if you're crazy, the crazy people know they're not crazy. They don't ask, do you think I'm crazy? You know? So, I mean, that's the benefit of being in inpatient settings. Okay. And it's crazy. So back.
Dr. C, awesome. All right, so we'll move into, we have a couple minutes left. So using collateral session, I think this is where the anxiety comes into, to enhance treatment, using collateral sessions to enhance treatment. Getting a little bit ahead of myself in my words. So we want to make sure that we have that contact with the parents, teacher, school counselor, probation officers, DCFS, whoever. And the issue that comes up, and we won't go into, we wanted to ask you about those reservations about collaterals, but we are running out of time. So, but one of what we see is the main issue is how, and as it was mentioned, is it collateral information or are you disclosing that confidential information? Well, here's some things, right? Scheduling, you talk to the parents about. We talk to the school about scheduling. It's not something confidential. You tell them ahead of time. You tell them when you come in, who your collaterals are going to be and what you're going to be discussing. Progress. That doesn't mean that you're going to tell all the details of therapy, but you're going into your, you know, child is doing well, or they've missed sessions, or this and this and that, right? But you're not telling them all the details. Your child has, you know, your daughter has a boyfriend, and I know you're totally against him. You're not going into that. Gathering information on their current symptoms and behaviors. They can tell you as much as they want. You can't tell them all that, but they can tell you anything, right? So understand that one. Homework and support. How can the parent, how can the caregiver, how can the school support the child? You can talk about that without divulging all that specific information, right? Interventions that may need caregiver support. Goes back to homework, school scheduling sessions, letting them know of the missed session. School can give you as much information as they want, right? Understand that it's okay, but you cannot divulge certain information, but they can tell you anything. Okay, and let me see what other slides we have just to make sure. So if any of the other supervisors have any questions, we just have one more slide. So I'll bring it up and then, any input. Here we go. Any collateral information that you have, put it on the face sheet, right? The collateral sessions, they take place outside of your session. You put them in the face sheet. You talk to the school counselor. You talk to the DCFS. You made a child abuse report. You called the parent because the child missed their session. You left the voicemail for the child. You texted your client. All that stuff goes into your face sheet. This is your log. This is how you're tracking all this information outside of session. Okay, so, you know, a couple minutes, and this is actually our last one. So if there's any of the supervisors have input as far as working with collaterals.
I'll say to that, and you know, this often comes up, like, what is it that we're talking to them about? And sometimes that fear of like, I don't want to say too much, because to be honest, there are some parents that will say certain things to have us divulge information. Oh, my daughter said, is it true that you said, right? So in those moments, like, we don't want to be caught like deer in headlights. So how do we, what language are we learning to sort of curb those kinds of questions? Oh, well, that's an interesting comment. You know, maybe our next session, we can have it as a family, would be a good way to sort of return that you're not answering, but you're like, let's have a conversation all together so we can clarify any misinformation. And then the part of having sort of a set of questions and knowing what's your purpose, what's your goal in having this collateral? Are you gathering information? Are you wanting to know, does a parent see progress? Are there any additional symptoms or behaviors? Like, just have a set of questions for yourselves to know where it is that you're going with this, especially when we're thinking or wondering, like, is this a good time to close? The client isn't really divulging. They're not, it's like pulling teeth. And then I don't want to go into a collateral session with the parent to say, you know, it seems like your child doesn't want to share information. I think we're at a good, like, pause and ask, like, let me find out where the parent feels their child is in the session, in therapy. How are they doing at home? You know, what have you noticed? What other concerns? How do you feel therapy is working? Like, really go in with a set of goals so that you're not just shooting from the hip, because that might get sidetracked really easily into something else. So I want to keep it short because I could definitely go on about that one, but anyone else?
No,
I'm good.
I'm good too.
All right, well, thank you everybody for your time, and we're at 2 hours at 7 o'clock. So I really appreciate everyone here.